Thank you very much for inviting me here. So, here I am in the Ukraine. In the last days I'm here, lots of memories come actually back to me. I'm from Berlin, I'm from Germany, and at the beginning of the invasion in 2020, lots of Ukrainians actually came in these first months and weeks to Berlin. They arrived here at the train station, and my husband and I and friends, we went also there to help, and it was a very overwhelming situation for all of us, those who arrived, but also those who have been helping. And Ukrainians arrive with their children, small children, with their cats, with their dogs, with their canary birds, with their grandparents. So it was really, and you saw this shock, they were horrified, but also they didn't know how the future will be. Now, about 600 days, or more than 600 days later, there's lots of grief. Maybe this has been at that time before still not the case. Lots of soldiers, lots of Ukrainians have been dying, and now we have a completely different situation, that there are lots of people who grieve in the Ukraine, and we need to think about, or we all have to, also the researchers have to think about, how can we help so many people who are grieving, who need support. As we heard also yesterday, grieving people ask for support, ask for cure today, and we still need some kind of low threshold interventions. Parallel, we are living in a time of digitalization. This means lots of things are going online, and that's also the topic of my talk today. Can be online grief interventions be an option to support grieving people? And are they maybe the same as helpful as face-to-face, traditional face-to-face interventions? And what can we do? And I would be happy to discuss this then afterwards. Yes, let's take a step back. Before the war, there has been the pandemic, and I think all of us have been in the same boat worldwide. We have been suddenly working from home, and lots of things seem to be suddenly possible. Also, online therapies, online interventions, and lots of things just completely changed. Gerhard Andersson, he's a researcher from Sweden. He's a very well-known researcher in the field of e-mental health, online interventions. He wrote, you see here relatively early in March 2020, an article which said, actually this pandemic is a black swan momentum. And the black swan momentum comes actually from the economy, which says it's an unforeseen event that changes everything, like a black swan in a population of white swans. And he wrote, we expect that this black swan moment will lead to a partly so robust shift in mental health care, provision towards online prevention, treatment, and care in the near future. And the question is, of course, you might also wondering this, can be online bereavement interventions replace actually face-to-face interventions regarding their efficacy, like their outcome? And I just give you here a short overview about what I'm going to talk about, how are grief interventions actually working. We have done a number of studies, clinical trials at our research department over the last 15, 20 years with different groups of bereaved people. Then we take a look at the efficacy of these interventions. I will present you the results of a meta-analysis, and then we take finally also a last look at smartphone applications and artificial intelligence, which is also an issue which comes up right now. Okay, I give you here an overview over the interventions we have done in our research group in the last decades, or years. So we first have a very general internet-based intervention for people suffering of complicated grief. Here we included parents, sisters, brothers, partners, so it was a very diverse group. Then we had an online intervention for mainly mothers who suffered of prenatal loss. Then we have an internet-based intervention conducted for the loss of a sibling, a brother or a sister. And the last one, the newest one, was an online group intervention after suicide bereavement. And I'm going to show you the results and also how they are conducted of these 3 interventions. Okay, let's start with this first one and maybe also oldest one. You see, this is from 2006, so this is already quite a long time ago, so long before the pandemic. And actually, maybe when you think of online interventions, you might think this is something like very high tech, like with a smartphone app or, but actually it isn't. Most of these online interventions are actually structured writing interventions. So something actually very old-fashioned, but put into an online setting. And how this works, I will tell you now. So the first one who actually brought this topic up, that writing about traumatic experiences is something helpful, was James Pennebaker from the US. And since then, the first studies have been done, 1986, there have been really about 50 or 60 studies which have been conducted repeatedly to find that actually writing about traumatic events is something helpful and also reduces traumatic stress or also grief. So writing as an intervention has something very particular, meaning that maybe you also notice from yourself, maybe you also have started to write down your feelings or your experiences during the war. If you're writing down difficult emotions, difficult feelings, this gives you some kind of structure. And it gives, especially if you are bereaved, also some kind of meaning making again, because you create an own narrative again about what has happened. So how does this work? I just give you an overview about the basic components of these kind of interventions. So I'm a cognitive behavioral therapist. You will also notice this later because this actually reflects this also a lot. But they are all based on cognitive behavioral therapy, trauma-focused interventions. The intervention itself is only 5 weeks. The participants or the bereaved people, they get about 10 writing assignments based on the structured cognitive behavioral treatment manual. And this is maybe also important, patient and therapist, they communicate only text-based. So this is not a video, it's not a chat, it's just really like writing relatively traditional text. And the therapist gives always individual feedback about what the patient has written. So I walk you through this intervention, which is actually was based from a research group from the University of Amsterdam of Freddie Lange. He developed this for post-traumatic stress disorder, and this has been now adapted for complicated grief or prolonged grief disorder. So in the first part, the participants are asked to write 4 essays about the most traumatic event that they have experienced in context of the bereavement. This can be like having received a death notice or having been at the death, moment of death there as well, or like a suicide, or no, whatever is specifically traumatic for these participants. Then they are asked very detailed to write down their emotions, what have they seen at that moment or in the situation, who have they met, how did the room maybe look like, but also write in the first person, like I have been at the hospital, I am at the hospital, and in the present tense. So this is very important to make it very directly, very intensive also. And this is a very classical exposure method of cognitive behavior therapy. The next one is the next phase. These are also altogether 4 letters they write. They're asked to write an encouraging letter to a fictive person who has experienced exactly the same thing like they have. So they give them advice or ask them, they question also dysfunctional thoughts like feelings of guilt or feelings of shame or having not been there at the point of the time of death, and giving recommendations about rituals. And the last phase is called social sharing. Here they can choose a letter to themselves, a letter to the deceased person, or a letter to a close friend. And this is like they reflect the time, what has happened actually, then how they have changed during this writing process, and what they wish for themselves in the future. So this is more or less the basic of this intervention. Here, you don't need to get into detail, but I just thought I bring this to you. You see here, this is this first part, this white part, is this individual answer of the therapist to the patient, what they have written. And the rest here, there's more in the screen, blue bit, this is a standard text, which is like the writing instruction, which is for all patients the same. So it is on the one side, individual, but on the other side also highly structured, so that everybody gets actually the same kind of cognitive behavior intervention. Okay, I brought you here some short text of this first phase, which we call self-confrontation. This is, let's say, Mrs. Miller. She lost her son through suicide, and she's here asked, this is one of the writing instructions, dear Mrs. Miller, in the following, I would like you to write down as detailed as possible a situation in connection with the death of your son that continues to be very stressful for you. It is important that you write everything down as much detailed as possible. For example, what did you feel during the incident? What sensory impressions, smells, sounds, images did you have during the traumatic event? Write in the first person and in the present tense. For example, I'm walking through the forest.